Good morning, everyone. Welcome to the last session of our interesting and very well attended course on climate change and health. This is our last session, as I said, and I hope many of you have been with us throughout the past 10 weeks. Time runs very quickly, and it seems that it was only yesterday that we started and we are already closing. So I'll be introducing the session and moderating the question and answer as well. And we'll have time to for you to ask questions. So if you have any questions, ask them on the Q&A box. I'm just going to upload the slides. So as I said, this is our last session, session 10, and the theme is Europe in the global context. And so the learning outcomes are to analyze the impact of climate change in Europe and see how it compares with the impact across the globe, particularly looking at the countries that are at the forefront of the climate change. Then to explain the cross-border impacts of climate change over multiple domains, including trade, economy, food, energy, to discuss the responsibility of Europe to mitigate climate change because Europe has been a major contributor to greenhouse gas emissions over the past centuries, to analyze the concept of climate justice and the need for developed countries to compensate and support the low and middle income countries with loss and damage. And then to discuss the importance of international commitments like those that are made at the COP events, the Conference of the Parties, in reducing greenhouse gas emissions and promoting climate justice. So they will have a 90-minute session. And first we are going to hear a lecture by Dr. Maria Neira, and then we'll have a case study, and we'll finish with a Q&A depending on time. And the last 15 minutes will be for the ASPER and GCCHE representatives to give us the concluding remarks. So the session is being recorded and will be posted on the website within 24 hours, and all the reference materials, the slide decks, etc., will be included as well. So participants who have attended over 70% of the live sessions and passed now the final exam with a score over 70% will be awarded the certificate. Participants need to join the session using their personal unique Zoom links and complete the final exam using the email address they used to initially register for the course. So attendance is automatically recorded, but you need to use always the same email. So the exam will be available from today at 6 o'clock Central European Summer Time, and will be open for 48 hours. So from 6 p.m. today until 6 p.m. on Thursday. And the certificates will be awarded on April 16. I would like to reiterate that you'll have plenty of time. You have as much time as you want to complete the exam, but you need to do it in a single go. So you can't start and stop and then go back. It won't work that way. So please be careful. When you start, be mindful that you will have to complete it in one sitting. The exam will be sent out at the end of today, as we said, and it will be a combination of multiple choice and true-false questions. And I have already said both certificates. So the session today will start with Dr. Neira, who is the Director of the Public Health, Environment and Social Determinants of Health Department of the World Health Organization since 2005. And then we'll have a case study jointly presented by Dr. Hazem Agha, Assistant Professor of Public Health Nutrition, Dean at the Faculty of Public Health, and in Jerusalem, and Professor Nadav Davidovitch, who is affiliated with the Ben-Gurion University of Negev, Department of Health Systems Management in Israel. So, as this is the last session, we would like to thank everyone who presented. We have an amazing panel of speakers from all over Europe and some international as well. And don't forget to give us some feedback, because we would like to continue running these courses. And your feedback is really useful for us to understand whether we are pitching the sessions at the right level, whether we are choosing the right topics for your to develop the skills that you would like to develop. So you can either scan the QR code that you see on the screen, or keep an eye out for the link that will be shared on in the chat box. So without further ado, I will give the stage to Dr. Neira. Thank you.
Thank you. Thank you very much, Kate, and good morning or good afternoon or good evening to everyone. Because this is the last session, I feel as a kind of big responsibility on making sure that we will close after all of these wonderful presenters that you have, and I'm sure that very enjoyable learning process. As I say, a huge responsibility now to leave you with something that hopefully will stimulate more action and give you more reasons to do, not only to learn about climate change and health, but to be prepared to respond to this terrible crisis that we are all facing. I see as well that there is a very high level of number of participants connected, and this gives me, again, a very strong motivation for engaging with you and making sure that, as I say, not only you will engage on learning and knowing more about climate change and health, but hopefully you will be able as well to pass the message, to engage on the solutions, and to use your political power as students, as professors, as health professionals, to change one of the biggest challenges we have in front of us. You heard many times probably the World Health Organization saying that the climate crisis is a health crisis. This is an important and a strong sentence, and probably we can use it for advocacy, we can use it for stimulating more action, but let's think together what that means and how we need to all react to that. I mean, it goes beyond a slogan. Climate crisis is a health crisis. Yes, it is. It's taking and shaking all the pillars of our health: access to food, access to clean air to breathe, access to, of course, water and sanitation, and the capacity to have a house, a place where we live and not to be displaced. I'm sure that over the weeks, you heard already what climate change is doing to our health, so I will not take you that. But just to remind ourselves that if the situation continues as it is, we will face major problems related to vector-borne diseases. We will have more heat waves. We will have huge, massive displacement of people contributing to conflicts. And I'm sure that you all realize that climate change is contributing or will contribute even more to conflicts around the world, for fighting for access to safe water, fighting for access to shelter, or simply having a health system that will be able to respond to the needs of the people. More and more we see as well the impact on mental health. More and more we see the impact on destroying the health systems that are already in many countries around the world very much at risk. So this is the situation. And again, Europe is not out of all of this. Europe is not on a protected environment. Europe is not only part of the problem, but it has to be as well part of the solution. And I think never than now, the responsibility, the role, the engagement of the health professionals on a very large definition of what health professionals are about it has been requested. Let me start maybe with something that will sound a little bit distant for you. In the last years, my work has been more and more as responsible for the World Health Assembly to talk and to engage on energy issues. Who will say it, a few years ago, that the health professionals will be so much involved on what access to clean energy means for all of us. And now we are very much realizing that as many years ago, or maybe not so many, the health professionals were advocating for having access to clean water, access to sanitation as the basis for creating better health for our citizens in Europe, for instance. After the Second World War, the first decisions were taken was investing on having access to sanitation and clean water. Otherwise, we will not start to discuss about protecting the health of the people. Well, now, today, we have a similar debate, a similar situation, a similar strong position on energy. And the health professionals, we need to be prepared to drive, to lead this transition to cleaner sources of energy. And nobody should be able to tell you, whether you are a professor at the university or a student or a medical doctor or you are a GP, nobody should be able to tell you this is not your business, because this is very much our business. The way our governments at the European Union or individually, they are moving into this agenda on access to sources of energy that will not literally kill us is fundamental. And we need to lead that process, that transition, reminding everyone that if you want to tackle the causes of air pollution, the climate change, one of the things you need to do is to reduce our dependence, our kind of suicidal dependence on fossil fuels, and we need to transition to cleaner sources of energy. And one of the most immediate benefits of doing that will be the fact that we will reduce the 7 million premature deaths that we are having every year due to exposure to air pollution and all the cost that this represents for the health of our population, but as well for our health systems. And in Europe, we are not protected from that. We have every year 400,000 premature deaths caused by exposure to air pollution. So here is one of the reasons why when we talk about other sectors and what is our role in other sectors, the energy one has to be targeted. It's one of the key ones where we need to make sure that our voice is very well in that debate, telling everyone that depending on the choices they will make on the sources of energy, our health will be protected or our health will be terribly at risk. So be prepared to answer that. Be prepared to explain to everyone that the combustion of those fossil fuels are literally killing us. And if we change that, we can have not only enormous benefits on our human health, but we will have as well a more sustainable development, definitely as well a very good results on our economic development. So again, public health and energy are agendas that are now very, very much linked. The other transition that we all need to be prepared to lead, and In the European Union these days, you hear a lot of debates from farmers complaining, and the debate about the agricultural policies and all of that. We need to be part of this dialogue as well, because one of the transitions that will be very important for our health, and the transition that is needed if we want to tackle the causes of climate change, is the transition to sustainable food systems. And there will be asking us, the public health officers, the public health community, how the use of certain pesticides are having an impact on my health, which type of agricultural practices are maybe more intensive and therefore having an impact, maybe not on the agricultural products of this year, but the next one, and how we respond to all of those challenges related to the fact that we need to feed our population, but we need to feed them on a sustainable way, with a healthy diet. And if we move to these sustainable food systems, we will have healthy diets, and we can reduce as well millions of deaths that are now caused by lack of access to access to sustainable and healthy diets. The third transition, and on that I'm sure that you are already participating in a way or another, is the healthy urban planning, how we want our cities to be in the future. We want cities that will put at risk our health, or we want cities or urban environments that will protect us, cities that will allow us to have a less sedentary lifestyle, and therefore reduction of all of those diseases associated with a sedentary lifestyle. Cities where we have a sustainable public transport system that will respond to the needs of our population. Cities that will not pollute the air we breathe permanently, and therefore creating all the problems associated with exposure to air pollution. And of course, our buildings. We want buildings that will be energy efficient, or we want buildings that will spend and use fossil fuels for heating and cooling. All of these issues, maybe in the past, the health community were less involved. We were more focusing on the curative, and we were simply treating the result of this lack of preventive approaches, this lack of wisdom and vision by our governments, not having a good, healthy urban planning, not having a sustainable way of producing the food we need, or not using the sources of energy that will protect our health. But now we have no choice. We need to be very much involved on that. And for that, our voice will be very powerful. As you know, and this links me to the other part of the presentation, is the international agreements, the COPs, the treaties, and all of that. You know, I'm a medical doctor by training, and I've been, particularly when I was a young doctor, I've been exposed to the front door of a hospital where you need to take decisions on when the patients arrive, depending on the urgency, or depending on the how bad the situation is. You need to take decisions very quickly, and go into surgery or not, which type of response you will provide to this health problem faced by our patients. So this criteria of the sense of urgency, I think, is very much in our education, in our training. I'm afraid it's not the same for the environmental issues. The fact that COP is named COP29, we are going into COP29, it looks just as a name, COP29. But if you reflect what that means, it means that for 29 years, actually 30 years, the governments, the member states, have been negotiating something that, unfortunately, they didn't even reach a final decision on it. Can you imagine the health community postponing for 29 years something that we are all saying that is one of the biggest problems we are facing as humanity, as a civilization? I'm sure that this is something that we, as the health, public health, or community, we can't afford. So we need to bring to all of those negotiations two things: ambition, because they need to be much more ambitious, because our health is at very much a part of the game. And we need to bring speed, I mean, the sense of urgency, which is not there. And only health can do that. That's why at the COP28 last year, when for the first time we have a dedicated health day, that was our message. The health argument for more climate action. This is the argument that our citizens will understand. We need to make sure that everybody understands that this is not just about polar bears in the future, in next generations. This is affecting the lungs of our children now. This is linked to the asthma cases. This is linked to obstructive chronic pulmonary diseases. This is linked to lung cancer. This is linked to dementia, because we have now more and more evidence about the linkages between exposure to air pollution and how our brain is affected. So we need to use the health argument to push for this agenda. And in my opinion, only the health argument is the one that will bring these two elements, urgency and ambition. So again, a huge responsibility for all of us to make sure that we use properly the health argument. We are convinced, wrong or right, that because we have the health day last year, because of the voices of the health professionals, again, on a very large sense, I'm not just talking about people working at the hospital. I'm talking about those who care about public health. It can be lawyers, it can be many other people. We are convinced that the reason that for the first time ever, at the end of the COP28 last year, in the text of the communique was saying transitioning away from fossil fuels. That was, wow, the first time ever that we have that statement. And we think that is because the voice of the health community was behind pushing for that and making sure that everybody realized the next step has to be that the negotiators incorporate into the negotiation, because as you know, we are not part of the negotiation, we are just observers as the UN, but we need to make sure that the negotiators incorporate a health indicator in their negotiations. And instead of saying just talking about how many centigrade degrees we need to reduce the increase in the temperature, why not to include as well how many deaths we will prevent from reducing the air pollution, and therefore how many millions of deaths we will be hopefully reducing by taking a policy on taking transitioning away from fossil fuels. Let's measure that, monitor that by using an indicator related to our health. That is still a dream, but with your help, with using our collective power, I think we can make it. Then, of course, we have this role of producing the science, producing scientific evidence, keeping arguing, treating the patients, but at the same time making sure that we influence the work of other sectors, and we don't simply accept to treat the patients without influencing the fact that there are policies that we can put in place to do primary prevention, and where implementing the whole agenda on climate change will be a public health treaty. If they put in place the public health the Paris Treaty, that will be a fantastic public health treaty. We will solve most of the problems we are facing now. And even if for those that are using the economic argument and saying that, this will be very expensive, don't take it, don't buy it. It's not true. We are giving, at the moment, the governments are giving subsidies to fossil fuels for an incredible amount of money. We are talking about trillions every year going to those fossil fuels that are then responsible to all of those diseases and deaths that are costing a fortune to our hospitals. And that externalities are never included in in the economic cost benefits analysis that normally the member states are doing. So we need to make sure that if those subsidies that are now going to the fossil fuels could go to cover universal health coverage, we can probably provide assistance to almost the entire population with universal health coverage. So it's just a question of using our voice to move those financing approaches. And again, we need to be part of that dialogue as well. We need another role. We have another role. As the health system, altogether, we contribute to around 5% to the global CO2 emissions. And therefore, we can contribute as well to reduce that carbon footprint. We can decarbonize, if you allow me this expression, we can green the health system, decarbonize the health system. Obviously, only those countries, the medium and high income countries that are contributing to the carbon footprint. We are not asking Burkina Faso or many other countries in Africa or in Asia or in many other places around the world to reduce their carbon footprint simply because they are not contributing to the carbon footprint. On the contrary, they need to gain access to clean sources of energy. And for that, we need to promote in our health system the use of renewable sources of energy. We want to solarize healthcare facilities in Africa. I don't see any reason why our healthcare facilities in Africa cannot have a solar panel in the roof that will allow them to cover with all the needs in terms of electricity that we have on a healthcare facility to perform our duties as health professionals. But going back to the decarbonization, those who can afford it to reduce their carbon footprint, we have a group, a platform called ATTACH, Alliance for Transformative Action on Climate Change and Health. WHO is providing the secretariat, but many partners and member states are joined. We have already 83 countries. And the idea is to be more efficient on the way we do our supplies and the procurement, how we reduce plastic, how we make sure that there are environmental procedures when we do our procurement for the health system. And by doing so, not only we will reduce our carbon footprint, we will contribute to protect our people's health, obviously always prioritizing the health care quality, but at the same time, we can reduce our footprint. And we will reduce the cost as well of the health system. So many things we can do. I think this is a kind of positive revolution that we all need to start. It's a positive energy that we need to put in place. And is a movement that has to remind everyone that our health is very much at risk, yes, but we are providing the solutions, the ideas, the initiatives, and the concrete action that will take us to reduce, to tackle the causes of climate change. And this will be the best opportunity, a public health opportunity, and we need to transform that public health crisis that we are facing now into a public health opportunity. But this will be only possible if we mobilize the Europeans. They are playing an important role, definitely. You see that at the Parliament, European Parliament recently, they discussed the adoption of the air quality standards following the standards of WHO. We are not yet there, but it's a big step. And we have a role as well on leading, in championing, in supporting other countries to cope with the climate change consequences. Be aware that we are not all the same. The justice on those transitions needs to be very sensitive. We need to protect the most vulnerable, which are normally the ones not contributing to the problem, but the ones that are suffering most. And then we need to be sensible as well when we promote a transition from fossil fuels to more sustainable, making sure that we will not penalize those who need commute for working purposes, and they cannot afford to have an electric car because they are still very expensive. So we need to look at subsidies for a public sustainable transport system, for different ideas on how people can heat their houses or cool their houses, but not penalizing those who are not contributing, and therefore they can end up not only not contributing, but paying the price. So justice will be my word to close this. And with justice and all of this mission, I think all the elements for a green, healthy, and positive revolution on tackling the causes of climate change and generating health benefits is already in place. So good luck to all of you, and thank you for your attention.
Thank you
Back
very
to you,
much,
Kat.
Dr. Maria Neira. And yeah, I echo your incentive for people to take action in their local communities and make sure that they have this justice in mind in everything we do. We'll now follow up with the case study. So I will welcome Professor Hazem and Professor Nadav to share their slides and present their case study, and we'll have questions at the end.
Thank you so much. It's a great honor to be here together with Professor Hazem Ara, my friend. We are working together already for some years under the auspices of ASFERS, Association of Schools of Public Health in European region. We all know the unfortunate situation now, both in Gaza and Israel, after the attack of Hamas and the horrible humanitarian situation now in Gaza. And I hope that the case study we are going to present about the need to collaborate on a regional level will serve as an example, because unfortunately there are other countries in other regions in the world suffering from a similar situation. Before I'm sharing our slides, I just want to be sure that everybody heard there is historical decision by the Supreme Court in Strasbourg, rules that Switzerland violated human rights in landmark climate change brought by 2,000 women. I think these are important news that we need to understand. We're talking also about women's human rights. So it's a very interesting decision that is very relevant for the topic today about climate justice and health. We know that unfortunately women are suffering most from the consequences of climate change. Here I'd like to start our presentation, and we'll share the time. And again, the issue is the Middle East regional perspective. But before that, just a very quick reminder that, of course, when you're talking about health, most of it is determined by other determinants than just the medical aspects. And it includes also, of course, the environment, both built environment, the natural environment, the ecosystem. And as we heard in the presentation before, of course, macroeconomical and politics and culture and other global forces are important, but we cannot forget the local forces of neighborhood and regions. And all these levels must finally interact. One person, of course, cannot do everything. And this is why public health is great, because we are collaborating. We need to collaborate between the local level, the regional level, and the global level. They are all together important, but we need always to focus and remember what is our purpose. And this is something we like more because it's much more dynamic. It's from Jonathan Patt's book on eco-health. He was the leading author of the IPCC report that won the Nobel Prize. And you can see here the dynamic between natural and anthropogenic, and see population growth versus decline of natural resources. And you can see here things like migration, urbanization, economic development, industrialization, agriculture, and the decline of natural resources, how to interact. And it's probably more nuanced than the previous slide that was presented. And again, climate change is here already. You can see the Eastern Mediterranean. I have data from Israel. I hope that we can later also work together and bring data from Palestine, but all over the world, we see a rise in the influence of heat waves. And people might think, you know, Europe is not adapted, but maybe the Middle East is already adapted so they can react. No, also in the Middle East, people are dying and there's morbidity of mortality because of climate change. Now, we all remember how we mobilized regarding COVID. Of course, there were many issues, but we want to bring here, Professor Hazem and myself, the idea that why with COVID things were mobilized so quickly. We developed, the world developed a vaccine. Of course, it was not available. There's a problem of vaccine nationalism, but how we can use data in real time. Here on the right side, it's the dashboard in Israel, but there are many, many other dashboards on the local level and international level, and how we need to do the continuity of care between hospitals and community, between municipalities and health systems. Why we could mobilize relatively quickly with all the problems, and why it's not happening also with climate change. And that's something to remember and ask ourselves, and mainly it's because of political will. Of course, there is a need for expertise and there is a need for budget, etc. But we must have the political will within the systems and also from the prime minister or president level to put the question of climate change and health in the right thing. And here it's one of the articles that emerged from a meeting we had Israeli, Palestinians, Syrian and Jordanian colleagues in Italy. It was January 2020, and the year later we published an article, how we can learn from COVID-19 to discuss the question of climate change adaptation in the Middle East. And these were the main points of the publication: global health threats, no political borders. So to have an effective response, we must have regional collaboration. We saw what happened during the COVID-19 in Israel, Palestine, and Jordan, and we understood that we cannot have a copy-paste solution. It must be related to the context and the history and the demography and the politics of the region. And learning from COVID-19, it's clear that we can be better prepared for climate change impacts. Within ASPER, I'm chairing the Public Health Emergency Task Force that Professor Hazem is also a member. We're now just about to release several important key lessons. We released them also in the past, but things that are more systematic. We need to understand that we have the vulnerable groups that are suffering more, but also stronger economy must take a leading role in terms of creating regional resilience. And this can promote cross-border collaboration to address both climate, but also public health challenges. Because we are all together for better and worse. By the way, not just human beings, but also animals that are very important. We know about vectors, we know about zoonotic diseases, and this is the ongoing. A major point is the question of migration. Migration is here to stay. There is an environmental vulnerability, and migration itself is a socio-ecological model, and it by itself is a determinant of health. And of course, it relates to political and social drivers that interact. Both Palestine and Israel are located within the border of Africa, Asia, and Europe. And we already see environmental refugees. We see, of course, the situation in Gaza, but this is an extreme, although we discussed it already before the war in 2019. We issued a report together with EcoPeace. And climate migration has social, political, demographic, economic, environmental drivers. Many of them are climate sensitive, and people are going to migrate. And that's something that it's not, you know, if it's going to happen, but when and how we're going to react. And you can see here what are the different stressors: heat waves, water shortage, floods, acidification, And by different pathways of displacement, food security, energy poverty, vectors, it can lead to deterioration of outcomes. And this is something that we must act already now. And we need a political will, both within the healthcare system and also on the political level. The One Health approach is just one of them, and that's something that can be very helpful. In Ben-Gurion University, we developed what we call the new Negev Food Lab, that is working academics, government, NGOs, philanthropy. The food lab is to improve health of communities, including the Bedouin community in the Negev, to address both physical, nutrient, social, cultural, food security, food waste aspect for all Negev residents, including Jews and Arabs. And the idea is to use the concept of active residency to offer solutions, exploring community needs. These are all public health, of course, values. And again, this is to operate on the local level, but we must also remember the regional level. And here, Professor Hazem, if you can take the lead and describe the situation in Palestine. And again, I want to thank you for the friendship and your leadership.
Thank you, my colleague, Professor Nadav, and thank you for the organizer that gave me this chance to be here in the last session. And hello, everyone from the attendance. Now I will talk about the case of Palestine regarding climate change. So if what we mean by climate change is the reducing of availability of water, food, and energy, this inhibiting private sector activity under remaining human capital formation. Unfortunately, the Palestinian Authority has very few policies to address these challenges. So forgot to mention that all information that I will present now is adapted from the World Bank Group report regarding situation of climate change and development in Palestine that is released in Washington, D.C. Recently, September 2023. So the model projections in that report show that the water scarcity will be more prevalent in Gaza, while flood risk will rise fastest in the eastern part of the West Bank. And the increased rainfall variability, rising sea levels, and saltwater intrusion will negatively also affect aquifers and the groundwater quality in Gaza. So both in West Bank and Gaza, poverty rates tend to be the highest in the area, most susceptible to climate shocks and stresses. Also, cities here are highly exposed to climate changes given that their large population and densely concentrated physical assets. Okay, so as the Palestinian population is growing nearly each year by 3.4%, so the need for water and energy will continue to increase. This leaving the West Bank and Gaza ever more dependent on Israel to provide the basic services. The population growth also will intensify pressures on public services, natural resources, and urban housing, with negative implications for human development. So because Palestinian or many Palestinian firms rely heavily on water, decreased water availability poses an especially serious risk to employment and the growth in the Palestinian context. The nature of the situation here in Israel and Palestine, that the borderless nature of the climate change highlights the intertwined destinies of the Palestinians and Israelis. Left unaddressed or tackled only by one side, the negative impacts of climate changes will spill across borders and impacts on both Palestinians and Israeli lives and livelihood. Climate changes-induced water scarcity could intensify competition over shared resources and exacerbate cross-border tensions also. So the mentioned access to water will also undercut economic returns in many sectors of the Palestinian economy, potentially exacerbating unemployment, increasing dependence on Israel for livelihoods, and weakening a social and economic resilience. The lack of adequate wastewater treatment system on Palestinian sites is already affecting the environment on both sides of the border, and its impact will intensify as water uses increases. Restrictions imposed, unfortunately, by the government of Israel significantly limit the policy instrument and public investments opportunities available to the Palestinian Authority to address climate changes. However, it tackled jointly the positive impacts of climate action can accrue to both people live here. So as a conclusion of the case of what I mentioned, that given the intertwined destinies of the Palestinians and Israelis in the face of climate changes, enhanced regional cooperation would enable the Palestinians to achieve higher level of resilience to and yield mutual benefits. Over the coming decades, neither climate change itself nor its escalating impacts on Palestinian lives and livelihoods will remain confined to one side of the border. So there must be a joint action from both sides. Oh, sorry. The last slide in my case is talking about the nationally determined contributions that is assumed by the Palestinian Authority and the plan to till year 2040, that there must be more action and more work in these sectors regarding energy issues, health issues, transport issues, waste issues, agriculture issues, and water issues. This is what they proposed. Unfortunately, this was before the current conflict. I don't know how this will go forward during these circumstances. And thank you again, and thank you, my colleague, Professor Nadav, for what you mentioned, as it is actually the situation that we faced together. And thank you.
Thank you very much, everyone. I would welcome Dr. Neira, if you can, to come back to the session, and I have a few questions for you. The first one is, would you agree that we have an advocacy role, all of us, in trying to bring about change, particularly among politicians? And we also have a personal responsibility to reduce the use of energy, particularly when it comes to greenhouse gas emissions in our lives, especially in Europe. So I think the question is asking whether you agree that we need both the structural approaches coming particularly from governments, as well as individual actions to really achieve our goals in terms of achieving net zero or even becoming climate positive.
You want me to start?
Yes. Yeah, the question
Thank
is
you.
for you.
Thank you. Definitely the answer is yes. We have a role, we have to influence, and as I say, this is a critical moment in history where we need to have a very special role as the public health community and influencing. The second part is it has to be a holistic approach. Yes, we can fix a little problem, but this will not solve the whole equation. So we need to make sure that this is very much not adjusting this and disadjusting. Maybe you all remember an example a few years ago, it was a big promotion of diesel cars because they thought that it was, from an environmental point of view, it was a good idea, while nobody realized that by using diesel cars, the impact on our health will be really terrible. So changes of that, we need to have always this holistic approach. And third point is that this is for all of us. This is an agenda for all of us. As individuals, We need to do our own work on, of course, recycling, on the way we commute, the way we transport, the way we use our energy sources, but as well the way we vote. I mean, as a citizens, we have each of us a certain power, which is choosing our mayors, choosing our governments. And I think we need to use that vote to protect our health a little bit more. And then we have to lead by example. Remember years ago, you could still see in certain hospitals, doctors smoking. Today, it will be absolutely a shock if we will see a pediatrician taking care of a patient and at the same time smoking a cigarette. So same here. I think we have a kind of ethical responsibility as well of leading and giving some example. Of course, we are not pretending that the health sector will be perfect and green and all of that, not at all. But we need to make sure that we advocate on our daily life and our work and everything. But we need to go from COP, where the big global decisions are taken, to our daily life. If we are a GP on a very rural area, we have a role to play with our patients. And same if you are a mayor or if you have a big responsibility, we all have a role on influencing this, because it's too important what is at stake. And remember the Framework Convention on Tobacco. It has been difficult, but you know, a few years ago, everybody was smoking in the planes, for instance. Who will accept something like that today? So we really hope that with the voice of the health community, one day everybody will be moving on something more sustainable, and they will understand that this is the only way to survive and to be healthy.
I'll be happy to add, if that's okay. I think that without engaging with politics, of course, it can be of many different levels. Many times we're talking about national politics, but sometimes maybe it's not less important to discuss the local politics, municipalities. There are lots of things that can be done there, and also the politics of health organizations. Many of them are very reluctant to take seriously the challenge of climate change. Hospitals are among the worst polluters. They're using lots of plastics, polluting air, polluting water, land. There's huge food waste in hospitals. These are things that we're trying to engage with, but without the political leadership of the director of the hospital and also the leading professionals there, it's very hard. We have a very nice project with students from design that are sitting now within the major university hospitals affiliated to our university, and just looking around, and because they're coming from design, they have a different perspective. They're doing interviews and all related to the question of climate change. So I think we have a long way to go, because lots of people are just talking, but much less are doing something within the healthcare system. And again, I want to remind us the very important historical decision now given about Switzerland, about women's rights. This is true everywhere, and especially in poor countries and for poor people. Thank you.
Thank you very much to both of you. Then the next question is, do you think that European court's ruling today about climate change are going to really have an impact on EU and member states in terms of the interventions and the policies? Basically, do you think that climate litigation is a good way of incentivizing action and encouraging politicians or nudging politicians to take action?
Maybe I can start, but I'm sure that my colleagues will have a lot of good responses. Definitely, yes, legislation is a very, very powerful tool, and particularly to raise awareness as well. I'm sure that everybody knows the case of the little Ella in UK, in London, Ella Kisi-Debra. She was 9 when she passed away with a horrible form of asthma. And 10 years later, after a big fight of her mom and many doctors in UK, the coroner include for the first time ever in her death certificate that the cause of death was air pollution, exposure to air pollution, and not only asthma. So that was something absolutely more than symbolic. It's something that is changing the legislation. It's something that we need to make sure as well that no politician, no government will be able to say one day, I didn't know. You know, it's like maybe some of you might remember the amianto, the asbestos. Again, even politicians, that they might be in front of tribunals if they don't take the responsibility when we have enough evidence. So there is no way for politicians now to say, we didn't know. I didn't know that those levels of pollution were putting at risk my people, and those levels of pollution were caused by the combustion of fossil fuels, which are the same causes of climate change. And therefore, we need to use legislation as a powerful tool to advance on this. My dream, and I told you already one, the second one will be everybody adopting by law WHO standards on air quality guidelines. That would be amazing. Imagine the wow. There is some legislation around that already in few countries, particularly in Europe. We are among the best on that, but still a long way to go. Thank you.
Thank you very much. And then the last question for you is, are there any prospects for the WHO to receive proper funding to work on climate and health following the health declaration at the last COP meeting?
That's a very interesting question. And the answer is, you know, we are trying very hard to make sure that we have financing for climate change and health, because we recognize that we need to support many countries on having their health system more climate resilient and to respond to the big challenge that climate change is bringing to most of them, particularly vulnerable and low-income countries. So for the time being, this movement is not happening on receiving a big amount of financial contribution, but we really hope that it will be the case, and that is why we are fighting every single day to make sure that we will be able to support countries on their fight to climate change and how to respond, how to face it, and how to be better prepared for the future. So there are certain funds that are coming, but not at the level that the magnitude of the problem represents.
And
I
now
want to add maybe another factor here. I think similar to the fact that climate change and health cannot be just within ministries of health because of health in all policies. It cannot be just the World Health Organization. We must have the World Bank, we must have the OECD and the UN, of course. They are engaged, but I think that we need more coordination and more political power and political will to do so. And people ask about responsibility. So I think it's our responsibility as citizens to push for it on our agenda. And there are lots of things that can be gaining, like building back better and think that we can have win-win situations. Take transportation, you know, both reducing emissions and also having a better exercise and walkability, city planning, well-being. So there's a lot of possibilities to gain and win-win situations.
Then another question for you, Professor Nadav and Professor Hazem. Can you give a concrete example of where climate migration is happening around the world, if you know about it?
I think everybody knows the situation in sub-Saharan Africa. Israel through the boat, and Egypt and other countries got many asylum seekers coming from different countries. There are lots of interpretations that the civil war in Syria started because of lack of water. And there's lots of political unrest, I think, in many countries in our region. I think, Hazem, I think you also agree that when there is a lack of water, there can be political unrest, and this can lead people moving, of course, and very bad consequences.
Thank you. Another question is, considering the answer to the previous question around the climate litigation, what do you think are the best ways in terms of nudging, I wouldn't say forcing, but I would say nudging politicians to take action and really deliver on their commitments, because we understand that the commitments are made at COP are very important, and we have the national agreed contributions, but then, or the national determined contribution, this is, to what extent can we make politicians liable to deliver on their commitments? Because it's all very good to make these commitments at the COP meetings, but then if the commitments are not translated into real action, then we'll not really achieve the goals. And we know that at the moment there is a gap between what is written and what is actually being implemented.
Most of those agreements are not implemented. Let's be very, very strong on that one, I'm afraid. But we still need to fight for it and make sure that they are ambitious on that. However, remember that what is agreed at COP doesn't mean that it's the maximum, it's the minimum. So nobody will stop any country if they want to go further. I think this is an important point as well to know. I mean, the fact that some countries agreed on by consensus on something doesn't mean that if you are European, for instance, and you want to go further, nobody will stop you. So please keep on pushing your own countries and your own politicians to go for more, because this is just an agreement of minimum by consensus. The second one is that that's why the idea of incorporating a health indicator will be fantastic, because our citizens will understand whether or not we are compiling with those agreements. It's difficult for a citizen to see whether or not on the degrees Celsius we are successful or not. But if we tell them we will use as an indicator the number of deaths or diseases that can be attributed to exposure to air pollution, maybe they will see something much more concrete, and we can give figures of that. Another way to kind of push our politicians to take more action is, of course, the legislation, the knowledge of the population. The more the citizens know about this and how this impacts their health, the better, because they will be very demanding, and we can change the pressure that they will put on their politicians by using their vote and removing a mayor if he's not taking actions in certain areas that they recognize that this will have a negative impact on their health. And my last argument, I think this can be something very, maybe very tactic, and we are using it very often, is the positive argument. We can work with mayors particularly, and I say mayors because those are the ones who are closer to the immediate results. You can work with mayors telling them what will be the benefits, and we can quantify for them the health benefits if they put in place a measure like did the mayor of London on the ULEZ, the ultra low emission zones, you can calculate and estimate and provide information about how many cases you are preventing of certain diseases. So using the health argument, the politicians are very sensitive to that. If they can go back to their voters and say, you see, according to WHO or according to this university or according to this association of pediatricians, by doing this measure, we are reducing the number of asthma cases or people exposed to certain diseases. They love that. So let's use the positive argument as well, and not only the negative one. How many lives you are putting at risk, but maybe how many lives you can save by taking the measures you are taking, by removing traffic from a street in the city, or promoting a sustainable public transport system. Measures that maybe at the beginning are not very popular for the citizens, for the urban level, but measures that at the end will have enormous health benefits. So maybe using that health benefits and monitoring for them and giving them as a tool for them to use it, that's maybe another tactic on how to push politicians to be much more engaged and taking more action.
I think I'll just ask a final question, which is, we have been discussing things at global level, but then we live and work in our local environments. And what are the actions? How can individual citizens and public health professionals encourage action at the local level? What do you recommend, moving from the big P politics to small p politics, and also to community engagement, citizen assemblies? What do you recommend, and what do you think is lacking at the moment for a more effective action?
I think it's at the individual level, everything starts at home. What you can do at home in terms of recycling, the type of food you bring home, the plastic use, the commuting, the use of electricity, again, your individual vote, again, maybe using a bicycle to go to work, and maybe be very conscious of the type of contribution you have to the carbon footprint, but important as well to engage with others. And if you are at university, maybe create a little group and do more advocacy. Or if you are at a community, see whether there are other neighbors that can be engaged. If you are a practitioner, maybe create a group with your patients and then talk about that with other health professionals. We all need to associate as well on all of these and create little movements, and all of those little movements all together will be absolutely fundamental. I think there are now many associations that are promoting, for instance, the healthy bicycle use. There is a nice group in the UK. In France, as you know, they are promoting these walking places where they have removed the cars, and doctors are very much, and health professionals are very much supporting this type of initiatives. So at the individual level, you need to preach that every day. And as an individual, again, don't forget the power you might have on talking and influencing and doing advocacy at your university, or your school, or your community, or even at home with your family as well. I think we have a role as well to educate the next generation and making sure that we participate. So be active and be activist as well.
Thank you very much. I think we will wrap up here. Thank you very much, Dr. Maria Neira, Professor Hazem, and I think that Professor Nadav has already left because he had some commitments. And I'm going to welcome Laura on behalf of the ASPER. He is the coordinator for the work on climate change and health at the ASPER. and Daniele from the Global Consortium for Climate Change and Health Education. Daniele, do you want to come in? Yes, you are there.
Sure. Can you hear me? Yeah. So thank you for all the panelists. We have reached the end of this course, and it can be better than that with the experience and the presence of Dr. Maria Neira, who is the top authority in this topic on climate and health. And also with this lesson of solidarity and cooperation between Israel and Palestine, and with all the problems that we are seeing, we can see that they need to work together in many situations, and there is a lot of things to do as well. I would like to thank all the panelists that we had in all the sessions, and also thank Asfer to co-organize, Lohan and Kat to co-organize this amazing course. And we managed to train about more than 1,000 students here, panelists, I would say, because most of them are already professionals. And this is an incredible number for a 10-week commitment that this course required, and this only shows and highlights the importance and the urgency of this topic for the health sector. And we from the Global Consortium on Climate and Health Education, we have the mission to train health professionals to be able to apply the climate and health lessons in their work, to be able to respond, to be able to communicate. And while this course was a basic level, you already are able to work on your career, on your day by day, and you already have a lot of basic concept that you can apply in your day by day. And I would like also to invite all the participants to become a member of GCCHE, so you can keep going in your studies, and we can provide many resources, seminars, and a selected community that you can engage in working groups. We also give support to schools to develop their curriculum in climate and health. And you can join us as a member or as institution. I'm going to put the link in the chat later. And also, I have a special announcement. We have been doing this type of course, the regional trainings in many regionals of the globe. We have been doing in South America. We are now in the second edition in the Caribbean. And the European Union now, we done one in Southeast Asia, and we are going to start one probably in September for the African region. So people from Africa, be aware that we are going to launch a climate and health responder course in your region with your challenge and your case studies, and that's how we do. And I would like to congratulate all the participants, and we have a long journey ahead, and we can do this together and to have a better health world for all of us. Thank you so much.
Pat, I can now take the floor.
Sure.
Yeah. Okay. Do you hear me? Yes.
Yes.
I hope. So I I think that this was an amazing last session, closing an awesome course. So it's really for us, for all of us, it's a real success, not only by the number of people, and thank you, Daniele, to say that we were a lot at each session, but not only by the number of people who registered or followed each session, but also, and I would like to highlight that, by the high level competencies of the speakers and the quality of the information and knowledge shared. It's really amazing. So, of course, I would like also to thank a lot of people. Sorry for that, but I think it's really important. First, a great thanks to the Global Consortium on Climate Health Education, because they have done a lot with us for setting up this course. And also to all our members and partners who took part and contributed to with lectures and with case studies. And also I would like to thank particularly Maya, Nadav, and Hazem for this last session, because I think that it's a perfect illustration that we have to fight together, and we have to fight together on the basis of public health arguments. And your illustration was perfect to inspire us with that. I would like also to thank all the organizing team, and I hope I will not forget anybody, but of course Kat, but also Chiara, Mary, Yanis, Doris, Christiana, Susanna, and from the Global Consortium, Daniele, Halle, and Cecilia. So really a warm thank you to all of you. And a special thank you to Tara Chen. She's with us now, but I think that she has some connecting problems. But Tara, thanks a lot, not only for this course, but for all you have done, like climate and health fellow for us first. So really a deep thank to you, Tara. And finally, I want also to thank especially 5 School of Public Health, because they sponsored this course. So the EHESP School of Public Health in France, in Rennes, the Faculty of Public Health in Kaunas, in the Lithuanian University of Health Sciences, the Erasmus University School of Health Policy and Management in Rotterdam, in the Netherlands, the National School of Public Health in the Nova University of Lisbon in Portugal, and the Swiss School of Public Health Plus in Switzerland. So thanks a lot for this 5 School of Public Health. Now, perhaps just to conclude some words on the ASFER strategy, because it's really important for us. And for us, this course is part of our strategy to develop this area as a crucial part of a revisited public health competencies and curricula. And we will go on. We will reinforce our network. We have now a beautiful network, and we work together. We work together with the European Observatory on Climate Change and Health. We work together with many European public health organizations. We work together with WHO. So thanks a lot, Maria, for being with us. With IANFI, the International Association of National Public Health Institutions, and of course, with the Global Consortium, and we will reinforce our network in order to take common initiatives. And I'm sure that in the next future, we will have some initiatives together. We also will continue to map and support development of trainings in the field of climate change and health in our schools, in the schools of public health, but also beyond, because we don't have as we don't want to give this information only to the public health specialists, but very far beyond the public health specialists. We want really to enhance a real training and capacity building task force. And also, we will develop some case studies, and mainly with the European Observatory on Climate Change and Health, but also, I hope, with other partners. We want also to develop what we could call a public health awareness by being involved in all the international fora. So it has been mentioned several times, the COP, and for the first time, ASFAIR was present at the last COP, the COP28, and we want to be also present for the next COPs because there is this specific attention to health. We also would like to participate to European initiatives, of course, but also international initiatives like the Lancet Countdown or the IPCC work. And finally, we will contribute to extend our knowledge on the effect of climate change on health by developing research and interdisciplinary, transdisciplinary research and expertise in this field. So I'm convinced that now all of you, more than 1,000 people, are equipped not only to inform, but also to convince, to advocate, and to take action in order to fight climate change, the impact of climate change on health, and also to develop some actions. And we have seen that from the local level to the international level. So now we could say we are a huge community of ambassadors. We are able to show what are the consequences of climate disruption and to pledge for actions and solutions. And so I wish you success for your evaluation. I'm sure that you will easily pass the final exam and that you will get your certificate. And so let's stay in contact and work together for public health and for our planet. Thanks a lot.